Good morning. I'm Jeffrey Smedberg with the Recycling Programs Coordinator for the County of Santa Cruz. Am I close enough to the mic for it to do any good here? Yep. Really appreciate the California Public Stewardship Council for hosting this event, so we can share some of the successes that we've had. Our program we call Sharp Solutions for Home Medicines. It is a voluntary retail take-back program, and from the name of it, you can understand that it includes both sharps and medicines. And on this presentation, I'm going to focus on the sharps part of the collection. Yeah, okay, good. So I'm going to run through the slides, try to run through them fairly quickly, and there are a few points that I want to make, and I'll just tell you right up front what these points are. First is that people really want convenient and free take-back locations, and when you provide that, they really love it. Retail is the most logical place for take-back sites. The cost is reasonable, regardless of who's paying for it, and that we will be happy to share our experience with any community that wants to engage in a similar project. We'll help you set it up. Now, I expect that the people who came to this workshop, you're really interested in getting something going. So, and that you want to take action here, so I'm hoping that my quick presentation will generate some questions that we can take at the end. So, our Santa Cruz County is a very small county, 260,000 people. Besides the county government, there are 4 incorporated cities, and so in a way it's kind of easy to get a little cooperation among all the jurisdictions, and all of these jurisdictions have joined in this program. We started out with we got a California Integrated Waste Management Board grant, a generous grant to help us start, so we were able to produce a lot of publicity materials. I put a poster up there on the front. This is an example of it. It's both English on one side and Spanish on the other. We have a brochure that describes the program, and on the inside lists all the collection locations. We have 33 collection sites throughout the county. Of that 33, 31 collect sharps, and about half of them collect medicines. We have display boards for public offices or pharmacies or whoever wants to promote the program for us, holding our brochures. We have a very complete website that lists all of the collection locations. We keep that up to date. Also, all of the materials, the publicity materials, can be downloaded in PDF format. We've done some outreach at senior health fairs, Alzheimer's Association, the in-home support services program, which it's a county program which has caregivers so people with disabilities or long-term illnesses can stay at home instead of going to the nursing home. So, they have to deal with medicines and sharps too. So we've done a lot of public outreach. When we set up the program, we had a very skilled consultant who went around and talked to all of the pharmacies to try to generate interest in being take-back sites. And I have only done a little bit of that myself, and she was very good, and she talked a lot of the, including chain store pharmacies, to join the program, including Walgreens and Long's at the time. It's now CVS and the Safeway pharmacies. So they are a part of the program. This is inside that Walgreens store with the counter display right there prominently located. In the waiting area is the medicines collection container. Here's a customer using the medicines drop box. For the sharps, the way it works is the pharmacy has a biohazard container in the back of the counter, and so it requires that the person bring the sharps and hand it to a pharmacy person. In order to reduce the possibility of needle sticks, some of the pharmacies are using a plastic tray or wash tub kind of thing that they extend to the customer, and the customer puts the sharps container in there, and then they can carry it and drop it in the biohazard barrel without actually touching it. The pharmacies are only allowed to take sharps properly contained in an approved container, one of these red sharps containers. The household hazardous waste collection sites, there's 4 of them in the county, and they are allowed to take sharps still in unapproved containers because through our medical waste hauler they have procedures to properly deal with those. So if somebody comes into the pharmacy with a coffee can or a Clorox bottle or a plastic bag or whatever, rather than asking people to transfer sharps from one container to another, we say, well, take it to the household hazardous waste site, so at least they have a place to go. The company that makes our medicines collection boxes also makes a style that can be used for sharps. We have not used this self-service kind of a system, but those sharps containers are. And the last slideshow also showed. The last slideshow did show some other examples of self-service sharp containers. In addition to the chain pharmacies, all of the retail pharmacies, the locally owned retail pharmacies are part of the program. And here's a picture of Mark Wilson, the pharmacist there at Horse-Snyder's Pharmacy, and he's been one of our most ardent supporters. You can see he's got the literature all over the place. And the way the local pharmacy, their niche in the business world, competing against all the chain pharmacies, is they provide excellent customer service, and he gets the largest quantity of collections of both sharps and medicines of any other location in town. Behind the counter, we require that all of the participants that take back sharps also offer the sharps containers. And this particular local pharmacy has the widest variety and probably cheapest prices of all the sharps containers. Initially, we were trying to help people get over the hump of, okay, now it's, by law, you're required to have an approved sharps containers, meaning you have to shell out some more bucks just to have this container. And so we tried a sharps coupon, $3 off the price of a sharps container. And we used about 1,000 of those in the first year. And then we couldn't keep that up. And so then we bought a number of these 1-quart containers. On one side, it's got the standard biohazard label on it. On the other side, we put our own little label, which has our program name and a phone number and website, how somebody could locate all the collection locations that were available. If you go to and we gave these out at some of the pharmacies that had previously been using the coupons, and we also, that's pretty much run its course. We gave some to diabetes education programs. I just gave some more to a new medical program that's doing outreach to diabetics. Also, we make sure that the household hazardous waste collection sites have these available, because they're the place where if somebody's using a coffee can, that's where they're going to take it, and this is to help people get into a new habit. When you go to the pharmacy, you can buy one of these quart containers for maybe $5, and if it's a bigger one, it's a lot more expensive. We bought these for $1.37. We were working with a CVS pharmacy recently. They had changed a national policy. They were only going to carry $30 mail-back containers, and I managed to talk to somebody in the corporate office, and they pulled some strings, and now all the local CVS carry a quart container for $3.17, which I thought was pretty good. The biohazard barrels, those large ones are used in industrial or like hospitals and medical facilities, but we try and get the largest possible container in our pharmacies, and usually that's a 38-gallon, kind of a square tub. And the reason for that is as much space as they can afford to offer for the program keeps our costs down, because we're charged basically a stop fee by our medical waste hauler. And for that one stop fee, we're paying $60 for them to go by and pick up. But for that $60, they'll take any quantity of sharps. So we encourage the pharmacies to have the biggest container possible. They're processed, the company now that we're using called, coincidentally, the name of the company is Sharps Solutions. Our program name is Sharp Solutions. And I ran into the guy who ran the company because one day he was trying to get to his own website and spelled the name wrong and came up with our program. They tried shredding the sharps after they're sterilized, and they had this great idea. They were going to use a magnet and get the surgical steel out, but unfortunately people put too many strange things in. It kept breaking the hammers on their shredder, so they can't do that. They thoroughly sterilize all the containers before they go back out. They also deal with the pharmaceuticals, which are all shipped out of state for incineration. We have pretty good coverage throughout the county. In the urbanized areas, there's a lot of rural area in Santa Cruz counties, but our locations are mostly focused in the urban areas. Pretty good coverage throughout the county. Over 3.5 years, you can see the increase in volumes. It's up pretty steady now. We're getting about each year, the last couple of years, about 8,000 pounds of sharps. 33 sites, almost 900 pickups over that time. Over the 3.5 years, 21,000 pounds of sharps, and almost 30,000 pounds of pharmaceuticals. Our costs for both the sharps and the medicines is about $25,000 a year, and the frequency of pickup varies quite widely. Most of the chain pharmacies are getting maybe quarterly pickups on the sharps. Some of our places, the Walgreens take the farms and the sharps, and they're getting weekly pickup. How effective is our program? Using the EPA's estimates of 8 million people, home users of sharps, using 3 billion sharps annually, just prorating for Santa Cruz County population. 2.4 million sharps in Santa Cruz County, and we're collecting 8,000 pounds. Phillips Services did a little study, and they estimated that 52 needles per pound. One of these containers can hold about 42. We think we're collecting 18% of all the sharps used in the county just through this program. A significant number, obviously not nearly all of them. Our funding has mostly, when the grant funding ran out, the funding has mostly come from our wastewater treatment agencies. There's 4 of them in the county, and they're all helping fund this. And their main motivation is keep the drugs out of the drain. And if this were a Sharps only program, I don't know if they'd be so interested in funding it, and then we'd have to look elsewhere. So that helps for us to have the programs combined. And that's my contact information. So are there any questions about this?
Okay, hopefully we have a mic that works.
Yeah.
And we don't. We have no mics that work. So everything was working this morning.
Yeah, well, so if you want...
So you're going to have to repeat the question.
Yeah, go ahead. In the back?
Will you expand on your relation with Walgreens and CVS?
Yeah, sure. We're on very good terms with all the local pharmacists, and initially we interacted with the regional managers, regional pharmacy managers, and they were interested, and of course they had to check with their corporate office and their corporate legal department. CVS said, sure, we'll take the Sharps, but we don't want to touch the medicines. Rite Aid said, we're not interested, and for some reason Walgreens said, sure, we'll do them both. And
would you be willing to share the name of those individuals that you talked to, both at CVS